We've talked in other videos about medical treatments for CFS and fibro, and I mentioned that there are no standard treatments for either condition, that is, no medication that is consistently helpful for either one. Also, treatments may be effective for a period of time and then become less effective. So treatment of CFS and fibro often proceeds as a process of trial and error. In this video, I'd like to pass on some ideas about working productively with doctors. The approach we suggest is called taking part. That's a subtitle up here, taking part. And the letters mean prepare, be active, repeat, and take action. The first step is to prepare. And that means prepare for the visit by thinking about why you're going and what you expect from the doctor. We suggest you make a list of your questions or concerns and think about what you hope to achieve in the visit. So let me write that down as concerns and goals. Oops, didn't spell that right. Concerns and goals. Would you like some help treating a new symptom? Would you like a new medication? Do you want the doctor to submit a document supporting a disability claim? Write down your concerns, recognizing that probably no more than 2 or 3 issues will be addressed in one visit. As part of your preparation, consider rehearsing a concise description of your symptoms. Studies suggest that doctors often allow around 20 seconds for a patient to describe her concerns before interrupting. So be prepared to state succinctly your concerns and what you want from the doctor. I'll write that down as rehearse. Describe your problems and goals concretely so the doctor knows that they're manageable within the constraints of the appointment. Second step is to be active. Take an active role in your appointment. Begin the visit by describing briefly your main concerns, as I've mentioned. You might say something like, I came in to talk about improving my sleep. I've been having trouble falling asleep and I wake up several times during the night. The drug I've been taking doesn't seem to be effective anymore. If you have more than 2 or 3 concerns, give your list to your doctor. I'll write that down as statement, and list. Make your opening statement and pass on the list. Then take an active role in the meeting by interacting with your doctor. If you don't understand something, ask her to explain it again. And if you think a proposed treatment won't work or you're unwilling to try it, tell the doctor. If the doctor suggests a medication, ask some questions. How and when should I take it, and for how long? When could I expect to see the effects? What are the most common side effects, and what should I do about them? Are there other options besides the one that we've been discussing? How and when should I report to you about my experience with the drug? I'll summarize all that in the word questions, so ask questions. Third step is to repeat. To check your understanding, repeat back to the doctor the key points she has made. For example, you might state that you understand the doctor is recommending that you treat your sleep problems by taking 2 medications, one to help you fall asleep and the other to help you stay asleep. If you don't understand or you're not clear, ask the doctor to repeat. The purpose of repeating is to make sure that you and the doctor have a common understanding of the discussion and to clear up any misunderstandings of the diagnosis and of the steps that you'll take after the visit. As the visit is ending, we're down to step 4 now, make sure you're clear about what you're expected to do as a result of the appointment. Imagine you're back home and you want to follow up on the visit. Do you have all the information you need, and do you understand what the doctor has asked you to do? I'll write that down as, are you clear? Clear ? If you discussed a medication, did you receive a prescription? If so, do you understand how long you will take the drug, how many times a day, what hours, and what kind of side effects to expect? What about follow-up? Does the doctor want you to return? If so, how soon? Is it okay to check in by phone or contact her only if you have a problem? If you're not clear about what you should do as a result of the visit, or you're not certain you can remember, write down the doctor's instructions or ask your doctor to do so. So there you have a 4-step approach that you might use for doctor visits.